I want to talk about nursing homes. As we've shared with you during the past week or so, the number of new COVID-19 cases in our nursing homes continues to go down. Last week, long-term care facilities reported 343 new cases. That compares, and it's a significant decrease from what it was in December. So 343 new cases last reported. In December, the high was 2,832 new cases when these cases peaked in December. So we're definitely making progress there. I want to now, though, talk about nursing homes and visitation, because I know a number of Ohio citizens are concerned about this, both people who live and who are residents in nursing homes and assisted living, but also their family and their loved ones. Let me go back and kind of recap visitation and how this has progressed. When the virus first started to spread across Ohio, every medical expert that we talked to recommended shutting off visitation at nursing homes. We did that. I think every other state did it as well. So on March 13th, 2020, Ohio issued an order that limited entry, allowing only healthcare personnel necessary for the operation of the home. The order also allowed, though, for visitation for people who were near death. After a while, we started to hear from families, family members who told us that their loved ones were suffering in the nursing home because they were not being able to be visited. So in June, we started permitting outdoor visitation for assisted living facilities. We clarified and expanded the exceptions for end-of-life visits. Then in July, we opened it up more, permitting outdoor visitation for nursing homes and restoring group activities within nursing homes. So June, assisted living, then July, nursing homes. In September of this past year, there was a change. The federal government Centers for Medicare and Medicaid Services, known commonly as CMS, issued new guidance, regulations for visitations. Those federal visitation requirements are still in effect. Under these CMS federal regulations, a nursing home has to meet 3 criteria to allow visits. 1, there's been no new onset of COVID-19 cases in the last 14 days. 2, the facility is not currently conducting outbreak testing. And 3, CMS reports the COVID-19 county positivity rate at less than 10%. So those are the federal regulations that went into effect in September. And they override really anything that the state does. So the nursing homes have to comply with these federal regulations. But I do want to talk about some exceptions under the federal law. Even if the nursing home is not allowed to have visits because they don't meet the 3 criteria from CMS, visitation can and should still happen in certain circumstances. Under the federal CMS rules, compassionate care visits are always allowed. So let me repeat that. Under the federal CMS guidance, compassionate care visits are always permitted. Now, what are we talking about? What is compassionate care? Let me talk for a few minutes about that. Compassionate care is not just for end-of-life situations. Again, compassionate care is not just for end-of-life situations. Rather, compassionate care visitations are special visits in which a family member or other visitor provides comfort, support, and assistance to a resident whose well-being is suffering or at risk. These visits should be utilized in many circumstances to get that loved one well again, or to halt a decline in that loved one. CMS has a list, the federal government has a list of examples of compassionate care situations that include, but are not limited to, the following. Here are some examples. A resident who was living with their family before recently became admitted to a home and now is struggling with the change in environment and the lack of physical family support. That's an example. Second example might be a resident who is grieving after a friend, family member recently died. Or three, a resident who needs cueing and encouragement with eating or drinking previously provided by family or caregivers is experiencing weight loss or dehydration because they're no longer getting that contact with that family member or caregiver. Another example, according to CMS, of compassionate care. A resident who used to talk and interact with others is experiencing emotional distress, seldom speaking, or crying more frequently when the resident had rarely cried in the past. Now, additional examples. This is not an exhaustive list. So additional examples of situations where a compassionate care visit should be facilitated could include the following. A resident who has been readmitted to the facility following an acute care admission to the hospital. They go to the hospital, they come back, and they're not doing well. Or a resident has a new order for an antipsychotic drug, an antidepressant, or an appetite stimulant. Or a resident's dementia has dramatically progressed. And this is what I've heard from a number of Ohio citizens. Residents' dementia has dramatically progressed. Another example, during window visits, loved ones have noticed a change in the resident's appearance, grooming, or their cognitive ability. Another example, the resident is no longer responding to loved ones during virtual visits. These compassionate care visits are not just for nursing homes. Again, I want to make this clear. They also include assisted living facilities. So all these examples would include assisted living facilities. To make sure that there is a full understanding of this, I am sending a letter today. This is a letter that I'm sending to all nursing homes in the state of Ohio. It is to remind them of two very important things. One, that each nursing home needs to check their county positivity rate every week to determine their visitation status. They can go up online and look at that. And that is changed, potentially is changed every week. So that helps determine their visitation status. So every week, potentially, their visitation status can be changed by the federal government because of that. That's number one, to remind nursing homes to do that. Number two, to remind nursing homes to allow for compassionate care visits. The examples I just read are examples of where compassionate care visits should be allowed, no matter what the status of that nursing home as far as normal visitation. So we're talking about two different things, normal visitation and compassionate care. Now, we're seeing positivity rates across the state decrease. Soon, many more nursing facilities may be able to open up to allow more visitation. So that is changing. And every week we're seeing more as they change colors. Ohio facilities are required to report in weekly and update our dashboard to indicate if visitation is allowed at their facilities. You can find that on our dashboard. Families can access the visitation dashboard on our website at coronavirus.ohio.gov, coronavirus.ohio.gov. Red means visitation is restricted to only compassionate care visits. Yellow and green, counties could have visitation, those nursing homes in those counties that are yellow or green might have visitation depending on the situation at each individual facility. Remember, they also have to be COVID-free and not be outbreak testing. Everyone should look at the dashboard as it could potentially change each week, especially as cases continue to decrease in Ohio. The dashboard will tell you the specific visitation schedules and allowances of the nursing homes. Now, in the letter that I just held up, I also remind facilities that they must continue to allow for compassionate care visits, as I just outlined. If you have a loved one in need of a compassionate care visit, and that loved one is not getting that visit, and you're being stopped from visiting, you have rights. You're empowered to get that visit scheduled. Now, our Director of Aging, McElroy, is with us today to talk about those rights and what you can do if you feel your loved one's needs are not being met. Director, good to have you back on.
Thank you, Governor. I'm glad to be here today to talk about this important issue. We know that the COVID-19 health emergency has been very difficult on residents of long-term care facilities. Not only are residents at particular risk of illness and death, but they may be experiencing loneliness and isolation due to the restrictions on visitation. And as you mentioned, no matter what the visitation situation is at a nursing home, compassionate care visits can be allowed. Our long-term care ombudsman stands ready to assist residents and their loved ones and navigate the visitation opportunities in the nursing homes and assisted living facilities. The order requires these facilities to work with residents, families, caregivers, a resident's representative, clinicians, and the Office of the State Long-Term Care Ombudsman to identify the need, the length, the frequency for compassionate care visits. If you need a compassionate care visit, please feel free to call the Ombudsman hotline. That number is 1-800-282-1206. Again, that's 1-800-282-1206. Our Ombudsmen are here to assist and represent you and your loved one. Sir, I'd also like to take this opportunity to remind the facilities how critical it is to update that visitation dashboard that you referenced. We do have some facilities who are not yet reporting in. This is something that should have started October 19th, and we want to be sure that you're doing it consistently. We also know that you're reporting into CMS data that's critical, and we want you to continue to do so. If you wish to view your information, we have created an abbreviated CMS report that just features Ohio counties and positivity rates. So if you've been previously accessing the entire national data set, we have distilled a view of only Ohio facilities, and you can view this at aging.ohio.gov. We know that you and your staff are busy, but entering the CMS information is so important. It's being used at the federal level, the state level, and the local level to inform decisions and policy. I want to pivot for a moment on something that's also important and very much related to visitation. And that's a bit about some of the things we've done in the nursing homes to position us in a way to host visits whenever possible. We've provided many resources to help facilities address some of the requirements. For example, we've implemented a state testing program that facilities can still join, where their testing supplies and lab work are covered at no cost. We continue to help with any staffing shortages. And this month, we launched the vaccine maintenance program, which is so very critical to continue our efforts to vaccinate nursing home and assisted living residents and staff. Just last week, I had a chance to join the governor and talk about our webinar to launch this program, something we certainly believe we're leading out here in the nation on. You'll remember that under the federal program, our pharmacy partners supported 3 clinic opportunities in each participating facility to administer vaccines. Now that those first 3 rounds of clinics are concluding, we did not want to lose the momentum of vaccinating our long-term care residents and staff. So Ohio's COVID-19 vaccine maintenance program is up and running, and I'm happy to report that we actually can begin starting those clinics here in the next few days. So we want to remind our partners in the industry to please complete your program enrollment survey no later than tomorrow, February 23rd, so that we can be certain that we can get these vaccines in arms as quickly as possible. This is a fast-moving program. We're proud to do everything we can to keep the vaccines going, not only in the nursing homes, but in the community. So working together, staying safe together, using all the tools in our toolbox, the masks, the distancing, our infection control practices, and the vaccines, we certainly believe that we'll soon get back to full visitation. Thank you, sir.
Director, thank you very much.